There are groups of folks who are very suspicious of government databases, and so just in general, they're against the government collecting what they perceive as the government collecting more data, even if these are private healthcare entities. There would need to be, never mind the interim study, there needs to be more support from the community, that is both healthcare organizations who come in and say, these are services that we owe to our patients, and from individuals who say, it's not right that my own health information isn't where I need it. We're used to thinking of a macro level, and we're used to thinking of large public health projects, and I don't think that's the right way to go about this. I think public health projects and databases are a very, very secondary issue that are not as important as individual patients having access to their own information when and where they need it. And I think we just need to focus on the individual patient's right and need to have their own information where they need it. And that means if they go to a different urgent care, that it's available there before someone duplicates another x-ray of them. If they are badly injured and they go to the ER or they need a surgery, it means that even if they're unconscious and so they can't log into their own little phone app, but that the physician that they have asked to care for them can log in and check what their allergies are before they give them an anesthetic for the surgery and accidentally hurt them. The information just needs to be put where the physicians and doctors, nurse practitioners, PAs caring for the patients can, with the patient's permission, have the patient's information. Another issue that I will be working on next session that I do think I'll get through is a therapeutic substitution of medicines. So if I write a prescription for insulin glargine, right now it's a long-acting insulin, and if I send that into the pharmacy, I frequently had it yesterday, the pharmacy sent back and said, you ordered insulin glargine, but we can't give it to them because the insurance demands that they have insulin glargine. Now I had written Lantus, and they said, well, it needs to be Basaglar. Both of those are insulin glargine, and I had written on the prescription to substitute. But the pharmacy said, oh, no, we can't substitute those. So we'd like to get the Board of Pharmacy to put together a list of therapeutic substitutions. These aren't just generic substitutions, it's a slight difference, so that any prescriber, be they doctor, nurse practitioner, or PA, has at least the option to say, I give you my permission to substitute for that list that is put together. There are just so many times a patient doesn't get what they need, there's a delay in them getting what they need, so I'd like to make that better.